All right, we're going to talk about changing some surgical dressings using the aseptic technique. So we're going to talk about, first we're going to do a total knee dressing and then a hip dressing. So it's important to know before we get started what kind of dressing is already on the knee. So there may be an Aquacell, there might be a Mepilex, a Pico, or just dry gauze underneath this elastic wrap. So what I always do is I always just, with gloves on of course, peek underneath my elastic wrap to see what's under here. And it's just dry gauze. So that means it should be an everyday dressing change starting on post-op day 2. So the day of surgery is day 0, and then 2 days after that, we can change this dressing. If the patient discharges home before that, they will go home with the surgical dressing on and change it themselves. But if they're still here, we will change it for them. So we also need to know when surgery is, because based on the surgery date, that's going to determine when we need to change the dressing. So we're going to say the patient had surgery 2 days ago, and now we are going to change this dressing. So again, I peeked under there. I know that it's gauze, so I know that needs to be changed. So I'm going to take the elastic wrap off. Orthopedics likes this elastic wrap on. It's not part of required by any means for like Aquacell or Pico, but it does help with the swelling, so it's good to keep this on. So I'm just going to unravel this, and it's going to be used to hold the gauze in place if it's a gauze dressing. So this can be sent home with the patient. They'll have it on, but if we need to send another one home with them, like if the one they had on got bloody or something, we can do that. Otherwise, we can instruct patients to wash this at home if it gets dirty. Okay, so with a pair of clean gloves on, I'm going to remove the old dressing. So depending on if this is the dressing the surgeon applied, or if we applied it, it might look a little different. This is just 4x4s, so this is what we maybe applied. So I'm going to remove that dressing and throw it away. I'm going to take my gloves off, and we'll pretend I got a hand sanitizer here and do some hand hygiene. And now I'm going to assess the incision. The incision has to be assessed by an RN. It's part of the initial or shift assessment. So we're going to look for redness, swelling, drainage, all those signs of infection. If it's draining at all, the patient cannot shower, because it means there's a hole somewhere in that incision area where infection can get in. So we would need to dress that back up, let the provider know, and go from there. So next up, I'm going to determine what kind of dressing I need based on drainage. Usually beforehand, you know what kind of dressing you need, so you can prepare for that ahead of time. So I have 2 different kinds of gauze. Depending on how big your incision is, if you have a really big incision, you might want to use this pack of gauze. Otherwise, just using the singles is best, because they're individually wrapped. No bacteria can get in these wrappers. If I were to open this and leave it sitting on the counter for a few days and then use it, there could be bacteria, and then we're putting that right on the patient's incision, so we don't want to do that. So I'm going to start by opening my packages. And laying them on my table. Then I'll put on my sterile gloves. So again, this isn't a sterile procedure, but we use sterile gloves to keep it as sterile as possible using the aseptic technique. Put my sterile gloves on. So for all surgical dressings, they should be applied using sterile gloves. So for knees, tape, sometimes with all the swelling in the knee, tape can cause blistering. And so just laying gauze on top of the incision to cover it up is sufficient. You don't need to use tape due to that reason. And then we just take the elastic wrap, starting at the bottom, working your way up, because that will help with the swelling, push swelling up into circulation. And we'll just wrap This patient's leg is a little slippery. You can always get a helper to help you with this part. So we never want to touch the piece of gauze that's going directly on the incision. We want to touch the outside aspect of the gauze. Looks a little big on this mannequin's leg, but okay. So that is an example of how to change a knee dressing. I'm gonna move this down for our next example here. For changing a total hip or any hip in general. Take these gloves off here. So again, I'm going to assess what dressing is already on the patient. And we just have gauze. So once this gauze has been changed from the surgical dressing, we're going to say this was changed yesterday, then I need to change it again today. We'll say this guy is 4 days post-op. So I'm going to put just a pair of clean gloves on to remove the gauze. This kind of tape is also more likely to cause blistering. The Me-Fix tape is really what's best, and this can be used in Blue Bin. You can take a chunk off using a scissors and cut it. We no longer put the whole roll in the room due to waste, but we do have this tape available, and that's what they recommend to avoid blistering. So we're going to pretend this is a nice incision and not a wound. We didn't have much to work with as far as mannequin legs go. So I'm going to discard my dirty gloves and do hand hygiene and prepare my gauze. So we're going to say this incision is long enough that I need to open up this package of gauze. If for some reason I don't use each piece of gauze out of here, whatever I don't use should be discarded when I'm done. Because again, bacteria can get in there, and we don't want that to apply dressing with bacteria on it right to the patient's incision. So again, keep in mind that this is an aseptic technique. It's not going to be perfect, especially when using this tape, because these aren't sterile. These pieces of tape aren't sterile. So I can cut them and put them on my table here, but it's not going to be perfect. But like I said, we're not going to touch the part of the gauze that's going on the incision. Again, this patient's leg is a little slippery, so we're gonna... Again, if you need an assistant for this, anyone can assist with this, another RN, an LPN, a CNA. And then it's important too to educate patients and families on the importance of hand hygiene and applying clean dressings to the incision before they go home too. We're going over that while you're changing their dressing is a good time. This tape really likes to stick to sterile gloves, so you do have to be careful. So I always like to make sure I get the dressing on and secure, but I also like to cover any gaps. So here's a gap, here's a gap. I like to cover those because I don't want bacteria sneaking in there. So applying more tape to the edges if needed, if the tape didn't cover it from what you had already applied. So no matter what dressing, whether it's gauze, Aquacel, Mepilex, all dressings should be applied using a pair of sterile gloves to prevent surgical site infections.